Fellowship of the Great Physician welcomes you to House Call. Our hosts today are doctors of chiropractic, Dr. Joe Lala, Dr. Richard Jensen, life acupuncturist, practice independently in Shoreview, Minnesota. Let's join our hosts for today's program that will assist you in your quest for optimal health and well-being.
Welcome to House Call. I'm Dr. Jerry Lala.
And I'm Dr. Richard Jensen.
Wonderful to have you with us again today in this dimension of House Call. As the announcer said, Dr. Jensen and I are doctors of chiropractic, and we do typical things like most good chiropractors do, as well as we practice orthomolecular medicine, meaning that we look at the whole person, and we're science-based chiropractors. We don't do things that we don't have a scientific proof that it is called for. And today, of course, we're coming from Shoreview, Minnesota, but we're broadcast all over the United States and throughout the world. And for those of you who don't know where Shoreview, Minnesota is, it's a northern suburb of Minnesota. It's the least traffic congested, least polluted, most likely place to want to live, and it is the gateway to the north coast of America, because it's 35, Interstate 35 goes right up to the north coast of America. So do come and visit us sometime. We enjoy your telephone calls too, and we'll try to answer your calls and your emails, although we have to be careful on emails because of privacy factors. So today we're going to look at arthritis and fibromyalgia, how to prevent it, how to deal with it, how to diagnose it accurately, some myths with reference to it as well. So Dr. Jensen is going to lead us right into that for you.
Okay. Well, thank you, Dr. Lala. We're looking at arthritis and fibromyalgia. Both may be accompanied by persistent muscle or joint pain that's related to heredity, to an acute injury that you may have suffered, to late effects of prior injuries, so injuries that you've had now and long ago, biochemical imbalances that may have occurred in you, an internal toxicity that is causing some pain. Some of the myths that we're looking at with arthritis and fibromyalgia is that that there are normal aspects of aging. That arthritis is a normal aspect of aging, that muscle aches are a normal aspect of aging, and that's untrue. That's untrue. I've known people who close their eyes, and when their eyes are closed, they feel like they're back in their 20s. It's not until they see their reflection in the mirror that shows that they're in their 80s, and so that's a myth. Arthritis and fibromyalgia are caused by wear and tear on the joints and muscles. That's also untrue. That's why it's not a function of aging. It's not caused by wear and tear on the joints and muscles. Also, that nothing can help arthritis and fibromyalgia. That's also untrue. There's hope. There's always hope. Damaged cartilage and muscles can never heal. That's also untrue, that we have seen. So what occurs? What occurs in arthritis and fibromyalgia is that there is a progressive decrease of blood supply or nutrition to the bones and muscles and ligaments and tendons of the body. That the cartilage and ligaments and joints are created to absorb nutrients, much like a sponge absorbs water. So if you don't have the types of vasculature going to the area that's feeding the area around it, the cartilage and the ligaments need to absorb that from the area, not directly from the blood. So that's an important part of helping with cartilage and ligamentous problems. Now we're looking at, in the case of fibromyalgia, in the diagnosis of fibromyalgia, if we bring up this slide, there's particular areas that are sore in this person. It's at the base of base of the neck, as you see on the left side. It's at the joint between the clavicle and the sternum in the front there. If you're looking at pain, directly right in the hips, the top of the hips. In the inferior and middle aspect of the knees there, as you can see pictured on the bottom of that picture on the left side. Then you have also pain right at the base of the skull in the back, as we look at that middle picture, right up in here, up in the shoulders, between the back, in both of the elbows, both of the hip joints again, in the superior aspect of the hip joints. We're looking at in the front inguinal area here, the hip joints, and in the back, full of the gluteal muscles, and the elbow again.
Could be all or some of them, right?
Could be all or some of them. In fact, you want to have pain. In order for this diagnosis to be there, you want to have a majority.
And it's basically telling us that it's an alarm center.
That's what they are.
And rather than go in and treat that spot or massage it or something like that or manipulate it, it's to go and look inside of the body and say, why are these alarm centers going off, right?
Right, right. And so this is what we're looking for in that. And really, we're looking for health of the joints.
Right, and very much often when it's just massaged and it feels better after the massage, if it does, it's just like putting frosting on top of burnt cake. It's really not dealing with the cause.
Right, right.
So there are a lot of people receiving massage therapy who it may help them feel good temporarily, but it's not really dealing with internal health issues that are not being diagnosed.
You're not dealing with the metabolic issues that are creating this condition.
That's right.
Within the body, if it's just having muscle work done.
Yeah, it's true.
Okay, so part of this in some of the helps would be exercise. Exercise of a joint causes the muscles to contract and the cartilage to be compressed, and that's squeezing the fluids in and out like water in a sponge, and that's how you bring more nutrients into the cartilage. So exercise and mobility is very important in cases like this. Also, when resting, the sponge-like cartilage absorbs the fluids, taking in the nutrients that the cartilage needs to grow and to heal and to function normally. And it's very important to get those the constituents of the cartilage into it for it to be able to heal itself. And this process of doing that is interrupted in arthritis and fibromyalgia. So without proper nutrition, the digestion and the absorption of that nutrition and the alignment of the bones and the articular joints, pain sets in and tissues begin to shrink, and the muscles and the ligaments and the tendons and the joints stiffen and degenerate in these cases. So Dr. Lala, what else?
We can talk about drugs. Certainly we live in a drug-oriented society, and legitimate and illegitimate. There's a lot of money to be made in drugs. If there's any aspect of healthcare that should be socialized, it should be the area of drugs. It's just we're the only country in the world that allows for the markup of drugs that our United States Congress allows. So we are continually bombarded with drug advertisements. People think you have to take this drug or I'm not going to live. For the most part, drugs are like putting frosting on a burnt cake, only with many potential accumulative adverse reactions. So you can take something and take something and take something, and you may not get sick from it initially, but ultimately those adverse effects are going to accumulate and they're going to explode out of the body. So taking drugs may in fact minimize symptoms, but they do not treat or cure the cause. And that's the fallacy of the drug-oriented aspect of our society. So a good question now, why would we want to avoid even aspirins or NSAIDs? People are taking them by the billions, but it is well documented, but conveniently not mentioned, that NSAIDs interfere with the metabolism and repair of tissue, cartilage, and bones. Therefore, if I'm going to take NSAIDs, over-the-counter medications for my fibromyalgia or my joint or muscle aches or my myositis or my neuropathy, it interferes with the metabolism with the repair of tissues in my body as well as cartilage and bones. Right?
Right.
Right. Now, this means then that regular use of NSAIDs makes it difficult for our joints, our muscles, and our soft tissues to heal. So we may be diminishing the joint or muscle discomfort with taking NSAIDs, but in the long run, it also therefore interferes with our joints and our muscles to heal. Now, some possible adverse effects of taking NSAIDs, over-the-counter medications, are further loss of muscle, joint, and bone health, gastric hemorrhage, bleeding, stomach bleeding. Now, you won't notice that because by the time that blood gets to the intestines, it's all digested out. So, but it causes gastric hemorrhage or bleeding, so the longer you take them, the more that you take them, that's a higher likelihood that you're going to come into a risk factor of gastric hemorrhage. Thirdly, then, if it causes gastric problems, it's going to cause digestive problems or digestive issues. And by that we mean that it's going to upset the normal gastrointestinal flora, the normal good bacteria that are within all of our gastrointestinal systems. So if we take those things, it's going to interrupt that flora. Now, another thing that taking NSAIDs does is it predisposes people to anemia or low blood. Low red blood cell, low hemoglobin, low several factors when we, for example, order a CBC, a complete blood count on people who come in and they've been taking NSAIDs. I mean, we would be foolish, we would be negligent as doctors of chiropractic not to order a CBC to see what their hemoglobin, their red blood cells, and all of these other issues are. NSAIDs also predispose people to lupus. And we have done previous programs on lupus. If you're interested in that, we invite you to go out to our website and scroll down and you'll see lupus out there, and you can just download that into your computer very, very easy. And our courses, it says there, our website's address is www.housecalltv.org. And taking NSAIDs also predisposes people to other immune or autoimmune disorders, so like muscular sclerosis or muscular dystrophy. There's a lot of autoimmune disorders. Addison's disease is another one, and it predisposes people to their body's immune system attacking itself. That's what it means. My body's immune system is attacking my body because there is some deficiency, or I'm ingesting certain foods or chemicals that my immune system interprets as bad for me, so it attacks it, and I have then these autoimmune disorders. Like asthma is a classical example of that, a very classical example of that. Then, often, many of these issues with fibromyalgia and arthritis are misdiagnosed. And how are they misdiagnosed? They are misdiagnosed because of a lack of diagnostic due diligence. That means that in my education as a doctor of chiropractic, Dr. Jensen's education, have bachelor's degrees, have 4 years in chiropractic college, have a couple years of internship, been in practice for 7 years, I am called by my education to practice due diligence, just as a medical doctor is or a dentist is. We're called to do that. But with managed healthcare today, there's a sliding away from due diligence and saying, well, if we skip this test, maybe it'll just get better on its own, or we'll throw this drug at them, or we'll crack them in the back without an adjustment, or I'll go to a massage therapist and it'll feel good for a while. But we're not performing due diligence. So we have a lot of people who are doing things that are actually predisposing them to not only loss of health, but loss of life and well-being. So not performing due diligence is not looking at the whole person. Now, I realize that a dentist has been educated to look at the mouth, an ophthalmologist at the eyes, an orthopedic surgeon at bones, a cardiologist at the cardiovascular system, a chiropractor at the spine. But the chiropractor is really not just a spinal specialist, but has been educated to be a neurological specialist, to know that nervous system and to see how it relates to the spine and all other effects and health of the body. So not looking at the whole person predisposes people to being misdiagnosed, and when we're misdiagnosed, We are either malpracticed by the doctor, by the physical therapist, by the chiropractor, by the massage therapist, by the nutritionist, and or we start malpracticing ourselves. In effect, there's not only a lot of malpractice going on in the natural health industry, in the so-called wellness industry, which is just a joke. It's just another thing. It's just another hype. Or the alternative healthcare, another hype. What they're really doing is we are not looking at the whole person. We're looking at some type of tunnel vision that I believe that I have a specialty in this and a specialty in that, and because I can sell a bunch of vitamins and make money from it, da-da-da-da-da-da. You know, and it's just terrible because some of those practitioners could be malpracticing their clients, or the person treating themselves is malpracticing themselves. So again, then when it comes to NSAIDs and other drugs, we are, I don't care what it is, whenever man creates something, it's going to have adverse effects with it. When man discovers something naturally and aligns him or herself in those natural laws, in other words, doesn't change them, doesn't add to them or take away from them, then there aren't going to be any adverse effects. And all drugs cause adverse effects. So adverse effects of improper diet. So I can have an improper diet, it's going to have adverse effects on me. I can have adverse effects of taking food supplements, because even though you might be a male in a similar age group to myself or Dr. Jensen, you have an individual biochemical nature. It's your individual biochemical nature. It is based on your genetic structure as well as your environment from the time you were in your mother's womb to where you are now. So you have this individual biochemical nature, and without finding out and identifying with an individual biochemical nature is, you're going to cause problems for yourself. Another aspect that contributes to fibromyalgia and arthritis are digestive issues, where in fact the person has some inequality, some dysbiosis, some malfunctioning going on within their gastrointestinal system, which predisposes them not only to digestive issues, but when we have a digestive issue, we are in fact not what we eat, we are in fact what we digest and absorb. Some other problems that are related to fibromyalgia and arthritis are amino acid irregularities. Those are proteins. Some others are hormone imbalances, and some are spinal issues. And certainly Dr. Jensen is going to talk about those now, as he's well qualified to talk about them.
Thank you, Dr. Lally. You brought up some of the issues of how most people seem to treat themselves with arthritis and fibromyalgia with taking those NSAIDs.
Right, and we can't blame them for doing it because they're trying to help themselves.
They're trying to get out of pain. I myself am allergic to pain. I don't like pain.
I don't like pain.
No. And so what they'll do is they'll take these NSAIDs. And one of the things is the NSAIDs, in order to bring down the inflammation, they work on particular enzymes that create inflammation. Well, those enzymes, that's only one factor that enzyme works on. And what it also does is it has housekeeping duties, much like one of them is working with the turgor of the gastrointestinal tract, with making it so it's stronger. And if it's not doing that job, then we start to have that bleeding into our gastrointestinal tract. And due to that bleeding, then we start to have the anemia. So it's a cascade effect that you were alluding to. And so also within some of this, what we're looking at is the changes in the body now that can start to affect these problems with the hormone axis of influence. And this hormone axis of influence starts out first with a gland up in our head. It's called the thalamus. It's a controlling center. It's basically it controls the body, and it talks to by giving instructions to the hypothalamus, and then the hypothalamus puts it into the master gland of the body, then into the pituitary. The pituitary then will send signals down to the adrenal glands. And the adrenal gland is it's an extension of the brain that's found centralized in the body, so it's a brain effect on the body. And that adrenal gland, we use that a great deal of the time to deal with things such as pain. So if we're in chronic pain, it's going to affect, one, how we deal with that pain, and the neurotransmitters are going to start to be depleted that help us with things like digestion, so we get digestive problems. also. Now, these will also affect some of our other tissues that give off hormones, such as ovaries, and that will in effect affect the hormone-sensitive tissues throughout the body. And so if we look at those hormone-sensitive tissues, how they are affected by hormones, we have to look at how some of these hormones are created. So if we bring up the slide now, it shows how cholesterol is the basis for our stress hormones. Okay, and so our body is going to, in order to make these stress hormones, it's calling for more cholesterol. And guess what? The liver is going to create more cholesterol so that we can do this. And that cholesterol then goes into pregnenolone and into progesterone. Oh, and by the way, if you're trying to deal with that pain, you're getting high cholesterol from it. What happens is all of a sudden we get put on a drug that stops us from making that cholesterol. And then that cholesterol can mess up these hormones that we're trying to work with to help with the pain. So it becomes a vicious cycle. But it goes in. The cholesterol goes into let's go back here. Goes into progesterone, and that progesterone then starts to take one of two branches here. Actually, both branches at the same time, but one of them is deoxycorticosterone, and then into corticosterone, and then into aldosterone. And aldosterone changes our blood pressure, for one. And then on the other side, as we come down, we go into cortisol or into cortisone. And this, in effect, helps change, it helps us deal with pain, for one, in that it brings down inflammation naturally. But the other problem is in dealing with that is that it makes the liver start to create sugar, which turns us almost metabolically into a diabetic when that's happening on a chronic sense. And if that happens on a chronic sense, that sugar and the presence of inflammation around the joints makes the immune system work on those joints more, creating the arthritis and autoimmune diseases. We went through this in a program on inflammation that you'll find out on our website. Again, that website is www.housecalltv.org, and where it says where and when to watch, click on that, and then it says if you want to watch streaming video, click here, and just go down that list and you'll see shows on arthritis, for one, and another show that's on inflammation. It's very interesting show, and I suggest that you take a look at that also. Then, if we look at other processes from cholesterol, if we go back to this next slide here, cholesterol again goes through pregnenolone and then into 17-hydroxypregnenolone, and then that goes into DHEA. Now, DHEA is sort of a nexus that goes into our hormones that build us up. They're they're the anabolic steroids, and those anabolic steroids, such as testosterone and the estrogens that build up. Now, some people are more sensitive to these, but as we age, many times we find that we start to go down in testosterone, which starts to affect our muscle, and there we go into a problem called sarcopenia, which is a loss of muscle as we get older also, and therefore we start to move a little bit less. And what we were talking about earlier is that movement is what drives nutrition into the joints and actually helps us with the healing of those joints. And if we look at this next slide, it puts it all together, showing cholesterol, and it shows all the branches down there where we get the aldosterone, again, that's for our blood pressure, cortisone, which is the stress hormones, estrone, and estradiol, and estradiol, which will actually affects bone and deposition of bone and maintenance of bone and muscle through testosterone also. So it affects all those areas in arthritis and fibromyalgia through the hormones in that regard. Dr. Lala, how about our posture here?
Certainly, posture is extremely important. Dr. Jensen has already looked at some of the alarm centers that sometimes they refer to those as reflex centers or trigger points in the body, but they are alarm centers. They're not necessarily the cause of the issue there, but an adverse effect of those alarm centers. We've already also talked about the nervous systems, the cranial nervous systems, the autonomic nervous system, peripheral nervous systems, that in my opinion, there isn't any other licensed healthcare provider that is more qualified than a doctor of chiropractic to look at the whole aspect of the nervous system. We also talked about spinal subluxations or vertebrae out of alignment. We also talked about the feet, that really they're the foundation of the body, and if those feet are not tracking correctly, it's going to cause adverse effects all the way up right to the top of the head. Arthritis and fibromyalgia being two very, very common examples of the feet not being in proper alignment. As I've said on many, many occasions, the largest percentage of the new patients we see have already been to chiropractors, physical therapists, massage therapists, and the majority of them have never done anything with their feet. Maybe the massage therapist has tickled their feet a little bit and done some what they tried to pass off as trigger point therapy. So that's very, very important. And I would also make mention to you that there are that if you're going to go to a chiropractor, before I do that, I would certainly go out in the Minnesota Board of Chiropractic Examiners website and check to see if that person in fact is a licensed doctor of chiropractic, and if there have been any violations that the board has cited that practitioner for, then they're going to be there also. Now, that doesn't mean that if I haven't got violations out there, that doesn't mean that I'm not under investigation for some complaint against me, nor does it mean that I'm a good doctor, because the boards really work at trying to keep doctors out of trouble by making them attend continuing education classes such as Dr. Jensen and I have taught. But the boards of medical chiropractic examiners exist to protect the public. That's what they're there for. And so it behooves you to go out and check the Board of Chiropractic Examiners website to see if the doctor is in good standing. Also, there is nothing better than a referral that somebody's had a personal experience with that person. Certainly you have a pretty good idea what kind of people Dr. Jensen and I are because you watch us on television regularly, and you have a pretty good idea what our philosophy of healthcare is and our approach to human dignity and looking at the whole person. Also, there are many good things that can be accomplished with massage therapy, with physical therapy, but if you've been going to a massage therapist who's been manipulating your bones, popping any of your joints, they're practicing chiropractic without a license, and they need to be reported to the Minnesota Board of Chiropractic Examiners. The same issue, in my opinion, is if you've been going to a physical therapist or a medical doctor who's been manipulating any of your joints, your spine. They do not have the education that a chiropractor has in taking care of the human frame, especially in the techniques, methods of techniques that we are educated year after year, 4 years through chiropractic college alone, and every year we're required to have 20 hours of continuing education. Many of those seminars are, in fact, involve updating us on manipulation procedures. And as I said, the medical and chiropractic boards, the dental boards, they exist to serve the public. They do not exist to serve we chiropractors or medical doctors or dentists or nurses. They do not exist. They exist to serve the public. And if there's something, the only way you're going to catch up with a bad doctor of any kind or a bad physical therapist or a bad massage therapist is to report them to the Board of Chiropractic Examiners or their respective board, and they will look into it. It will not cause problems for you. It will not cause problems for you. As a matter of fact, they are obliged to keep your name private. So, long life and good health to you.